Welcome to the Cancer Disease Hospital. The Cancer Disease Hospital is the first and the only cancer treatment center in the country. We offer the comprehensive cancer care within this hospital. And the background to the establishment of the Cancer Disease Hospital goes way back into the 70s when we recognized that the cancer cases were increasing. There was what was known as the tumor clinic, where patients were being looked after. Most of these patients needed treatment abroad because we didn't have the equipment for radiotherapy then. The numbers for cervical cancer kept on going up. All these patients were being referred for treatment in Zimbabwe, and others were ending up going to South Africa. It was estimated that the patient that was referred to go for especially cervical cancer treatment in Zimbabwe, we spent in the range of $10,000.
We have developed in phases to the point where we are today. So we had a CDH phase 1 where we bought a certain number of equipment, and then we went on to CDH phase 2, and we are moving towards CDH phase 3. We've had, of course, a number of challenges, and each phase was addressing the challenges. Sometimes we're not able to offer everything that we can for certain cancers that maybe we can get in the Western world, but at least now, with the linear accelerator and some of the treatment planning systems software upgrades that we had, we're able then to now offer treatment that we could not otherwise have offered.
We started with phase 1, which was basically an outpatient facility. When we first established the Cancer Disease Hospital, we had one linear accelerator, a radiotherapy equipment. So with this type of equipment, we are able to give deep-seated tumors with radiation, as well as superficial tumors using the electrons. So the photon mode is for those tumors that are deep-seated, and the electron mode is for superficial tumors. We've had it, and it has been functional for now more than 14 years. We've been able to give treatment to most of our cancers that come to the Cancer Disease Hospital, those that require radiation. The Cobalt 60 machine is another radiotherapy piece of radiation equipment which gives radiation to deep-seated tumors. And then we had a high dose rate machine or brachytherapy machine. This machine gives internal treatment, and with this machine we tend to use it when we are treating the commonest cancer that we see in Cancer Disease Hospital, which is the cervical cancer. And in phase 2, that's where you find there is the nuclear medicine suites where we treat thyroid cancers, and also the bigger facility of inpatient was done under phase 2, where now we have a 252 bed capacity hospital, because previously all the patients that came for cancer treatment had to lodge within the bigger UTH, and it was becoming very difficult to have logistics for the patients, and most of the patients ended up on the streets, and it was difficult to look after them. So we had to have this phase 2.
Apart from the cancer treatment that is offered at the Cancer Disease Hospital, the hospital has got an imaging department. Within this imaging department, we have various machines, and these machines are computerized tomography, which is known as a CT, magnetic resonance imaging, which is known as MRI, ultrasonography, mammography, fluoroscopy, and other services like biopsies. Imaging department in a Cancer Disease Hospital is a very, very important department, as it helps in the management of cancer patients. When the patients come with cancer, the doctors do their plans for the patients, But before they send the patient for treatment, they want to find out the extent of the disease. So this department aids in the treatment of the patient. Magnetic resonance imaging is a machine that uses a magnet. It is different from a CT where we are using radiation to detect diseases from all different parts of the body. Patients are coming from various parts of the country to come and access this service from Cancer Disease Hospital. We also have a digital X-ray machine, which is the state-of-the-art machine where we are able to do general X-rays, complex examinations within the X-ray, like what we call intravenous urology, where the doctor wants to see how the kidneys are functioning and the other parts of the body. And we also have a mobile X-ray machine. This machine is able to move anywhere within the hospital. If our patient is admitted in the hospital and is not able to walk, we are able to do the X-rays in the ward. Other diagnostic services that are offered at Cancer Disease Hospital are laboratory services. We have a full-fledged laboratory department where our patients are provided with these services. Our radiographers are very, very well trained. As you may be aware, this is a specialized hospital. So when we get radiographers, we train them at a level where they are able to conduct these examinations perfectly. We are also starting radiography at Levi Mwanawasa Medical University, where we will be able to train the radiographers both in diploma level and at degree level.
We're also looking towards the CDH Phase 3, where we are going to upgrade the Cancer Diseases Hospital that is in Lusaka, currently here at the University Teaching Hospital, and we'll also have 2 new other centers away from Lusaka.
We are going to establish 2 other centers, one in Livingstone and the other one in Ndola. These facilities will offer radiotherapy services, they offer chemotherapy services, and they'll be linked to the bigger hospital. So the investigation that go with the treatment of cancer will be obviously attached to the bigger hospitals, such as Livingstone Teaching Hospital, as well as Ndola Teaching Hospital.